Assalamu alaikum to all of you. This is Nimata Lekhwani along with my group Zubair Ali. Today we are going to present case which is written on Civil Cardiology Center in Kevin 5, Sajad Ahmed. First of all, here is an introduction of Civil Cardiology Center. Civil Cardiology Center has been reducing its reimbursement to physicians for the work they perform. Physicians' costs continue to rise due to inflation and the availability of higher technology treatments of patients. Strategic cost management becomes critical indeed. SCM, the only way for a medical practice to remain profitable. In 2010, several large HMOs with the tens of thousands of members followed as SUIT. The healthcare crisis in Sakhar has to be solved in order to ensure that all citizens have access to quality care. Background of Civil Cardiology Center, Dr. Zubair and Dr. Shaikh are two renowned thoracic surgeons. They are graduates of the Ghulam Muhammad Mar Medical College and have each worked in the field of cardiac and thoracic surgery for more than 30 years. In 1997, they formed the Zubair and Shaikh Cardiac and Thoracic Surgery Medical Group, Civil Cardiology Center in Sakhar. Treat diseases involving organs of the chest. They replace and repair the valves in the heart, perform bypass surgery for the coronary artery disease, treat cancer of the lungs and esophagus. So here we are talking about the problems which are facing by the civil cardiology centers regarding cost and other. For the last few years, despite working harder, their efforts were not reflected in the practice's profits. Reports they received from their CPA firm showed that revenues were rising, but costs were rising faster. Early in 2012, they participated in a project sponsored by the Society of Thoracic Surgeons. The project built a model for the specialty, collected cost data from 40 participating thoracic surgery practices and generated cost for each practice. The business processes and list of the cost object in this study are shown in table 8 and 9. In table 8, we see the cost, where the cost occurring and for what and due to what activities the cost is going to hire. Medical and business activities processes service patient in office. This is the process of treating and managing patient during office visits. Two categories of patient are seen in this way. Service patient in hospital and other facilities. This is the process of treating patient in a hospital and interacting with patients and family. In the hospital, it includes making rounds, examining patients, etc. Obtain insurance authorization. This is the process of verifying insurance coverage, contacting the insurance company, maintain medical records. This is the process of collecting, entering, and copying the information for the patient's medical charts, schedule and coordinate surgery patient in hospital. This is the process of keeping track of patients in the hospital. It includes arranging patient admissions, managing transportation of patients, scheduling physicians rounds and surgery, keeping track of every patient in the hospital. Billing, this is the process of recording patient charges of service, resolve collection disputes and rebill charges. This is the process of evaluating EOBs and working with insurance company, providing information to third parties. This process involves providing information to the third parties such as attorneys, insurance companies. It doesn't include providing information to the referring physicians. Maintain professional education, maintain facility, sustain business, manage by managing and coordinating practice. Over to Zubair.
Okay, thank you, Nimirda. Coming towards the table 9. In table 9, the is already discussed that in project they have divided all kind of costs related to the patients in 4 cost objects. Number one cost object is a no charge of fees. visits in global period. Second cost object is chargeable office visit. Third one is chargeable hospital visits, and fourth one is surgeries. Now they have created the distinction between no charge office visit and chargeable office visit. The distinction between them is that in no charge office they do not charge the customer, or they do not you know uh, create the cost for no charge office visit, because this comes in a global period. In global period, we say that they are post surgical surgical visits, in which a patient visits the doctor after the surgery. So no cost is incurred in that visit. And in chargeable office visit, it is a separate cost object. Uh, therefore we record the cost related to that visit, because specific kind of expenses are incurred in that visit. And a chargeable hospital visit is almost same as chargeable office visit, but in that we do not authorize the insurance of the patient. And in surgeries, we uh, calculate this whole amount of practice expense that is incurred during the surgeries. Next slide. Now we have discussed the tables that have been used in the case study. So coming to us table one, in table one it is described that as already discussed, the 13 processes are business activities that have been used in the project by the medical practices along with the Civil Cardiology Center. So there have been costs recorded in table one of each business processes, and along with that, the number of MDs and other four cost objects that we discussed, their uh, number of their frequency is given, like how much MDs are present in each practice or CC, and how many surgeries have been conducted in a whole year. And this was table one. And in table two, the maintaining of medical records. It is a business process or activity, so its cost have been broke down, and yeah, so maintaining medical records have been break down into different business process costs. And in table three, particular to the Civil Cardiology Center, the number of employees like surgeons, physician assistants, and other staff members, which are full-time and part-time, have been given in table 3. Like some are full-time and some are part-time employees. Now coming to a third slide, reimbursement process. In this project, they've you know uh, created a process in which a medical practice engages for collecting the reimbursement. So they have divided that reimbursement process into the four categories. Number one is obtaining insurance authorization. Number two is billing, and number third is collection of payments. Number fourth is resolving collection disputes. These four processes are followed while calculating the or while receiving the payment from patients. And in table 5, they in table 5 they've particularly taken practice 1, and have uh, and they break down their service patients cost into the business process which are incurred, like staff fees and administrative staff salaries and other supplies which have been used. And coming to the last slide, Namita, next slide. Yeah, in table 6, they have calculated the unit cost of four cost objects that we already discussed, and they have calculated their unit cost, like number of no charge office visits, charge office visit, and chargeable hospital visits and surgeries. And they've calculated per patient cost in each practice, like in practice 1, 3, and 7, and FMMG, and I have calculated their averages. And they have calculated each cost object's unit cost. And in table 7, we have calculated it shows a breakdown of the unit cost of three of the four cost objects. In table 7, we have only taken three cost objects and have calculated and have divided that per unit cost of each object into further processes. Like in each cost object, which process have been used, and we have calculated per unit cost of that uh, cost object in different processes. So this was whole data related to the case, which we will be using in order to in order to solve the questions that we have given in the end of case, and try to solve solve it and reduce the cost. So this was all from us, and with this I will end our presentation. Thank you, Allah Hafiz.